Fabulous. Okay, so thank you so much, and thank you for inviting me to join this session today. It's been really interesting hearing what the other panelists have to say. So just to give you a little bit of introduction, my name's Liz Ashall-Payne, and I'm the founding chief exec at ORCHA. Excuse me. For those of you who don't know ORCHA, ORCHA is an organisation which is based in the UK, and our mission is to distribute high quality digital health solutions to populations, patients and healthcare systems so that they can really get the benefit of high quality solutions. If you do know us, you may know us because we review and approve digital health products on behalf of government bodies like the NHS, but also ministries of health across Europe and the Middle East. But actually our mission has always been to deploy these solutions so that people can get the benefit from them. And obviously, with the COVID crisis, what we've seen is this absolute requirement for digital, whilst we're all self-isolating or in quarantine, and particularly for those vulnerable communities who may be living with long-term conditions, or who may have had cancer recently, or living with cancer, or who are pregnant. You know, we need to support them to be able to self-manage in a way that we haven't had to do before. So what I'm going to talk to you about now over the next 10 minutes is really my aim is to help you know how to find the best digital health solutions to support your vulnerable communities and share with you the work that we're doing. I'm going to just quickly share with you a few tips on how to know whether a digital health or an app solution is safe, because obviously if we're going to deploy solutions, we must know whether they're safe. I'm going to share with you a couple of solutions that have met the review criteria that we take products through. And I'm also going to share with you a newly launched solution which you can use for yourself, for your families, or for your patients to be able to search for, find and deploy or recommend to your patients and communities. So the first thing just to say, this is obviously a current situation, but one that's really coming to life since the COVID crisis hit us, is we currently have access to almost 370,000 digital health solutions. In fact, it's probably more like 400,000. Every day we were seeing pre-COVID about 5 million people downloading one of these solutions. But what we weren't seeing was a true embedding of these solutions into clinical care or clinical pathways and into our healthcare systems. And there were 4 big reasons why we didn't see that. The first was awareness. People didn't know these solutions existed. The second was they didn't know where to find them because the app stores don't work. The third challenge, which is still the biggest challenge, is trust. Which products can you trust? And you know, since COVID, we've seen quite a lot of press about, is the data security of this product or that product good enough? So trust is still a really big barrier. And then the fourth big challenge is ongoing governance. And how do we know whether a product is going to stay the same post deployment of that product to a patient or to a population? And it's those 4 problems that ORCHA are particularly interested in. And these are the challenges that still exist today, but we're seeing a more engaged population. So we're now finding that more people want to find these solutions. But because that trust is at the core of everything, when we're deploying digital health solutions, either in a COVID crisis or other, we need to know which products are safe. And so ORCHA review and rate more digital health solutions than anybody else in the world. And we've been doing that for years. So we have this body of information about digital health solutions that we're able to utilise. But what I wanted to do is just very quickly give you a few top tips, because if you're going to be downloading an app or a digital health solution, just look at some of these top things when you download them. So the first is look at when the product was last updated. Unfortunately, 2/3 of all products on the marketplace haven't been updated in the last 18 months, which basically means that they're redundant, they're not being maintained and updated, and they will be glitchy, and therefore data security will be compromised. The second is really look at who the app or the digital health solution is trying to target. Is it trying to target clinicians, adults, teenagers or children. And that's really important because when we're looking at products, you need to work out what the risk is within that product. So obviously a product that's trying to support clinicians to help them do their job more effectively or more efficiently is much riskier than a product that's maybe around mindfulness and that's going to play music for adults. So really understand who the app's trying to target, and then that point 3, how complex it is. So if it is a product that's doing something pretty low risk, like playing music for mindfulness, that's pretty low risk. But obviously if a product's built on clinical algorithms, then that introduces quite a complexity and therefore risk. And make sure you understand what the functions and features are. If a product is going to link to social networks, for example, you might want to make sure that any risks associated with that are managed. If a product's going to provide personalised advice, again, you might want to make sure that those risks are managed. And this is the process that we go through when we first pick up a digital health product. What we then do is we then apply regulatory requirements to the products, and the regulatory puzzle is complex. So I've massively oversimplified it here into 4 jigsaw puzzle pieces. But really what you need to consider when you're looking at a product is the privacy, the data privacy well managed? Is it data secure? And obviously, depending on what the product's doing with the data, what data it's collecting, how it's sharing that data, depends on the level of interrogation you might want to put a product through. Is it clinically safe? And this is the biggest area of interest for most people, and it's the biggest area from a regulatory and standards and best practice perspective. So what is the clinical evidence that sits behind the product? Is it a CE certified medical device? What are the clinical safety issues? And then finally, from a user experience, does it meet user experience requirements, which are particularly relevant to accessibility requirements? Now, you might also want to look at other areas, so not just the regulatory requirements. You might also want to do a bit of due diligence on the developer, who it's designed for, what it works with. This is really more important now than ever. We each have our own technical ecosystem. So for example, I have an iPhone, I wear a Garmin, and I have an Amazon Alexa. And so I will want any solutions that I use to work within my own personal ecosystem. And so that's really powerful when you're thinking about these products. And also checking in on the commercial models. You know, we've talked about sustainability, and we will have to pick up that conversation at some point about how do we make this sustainable for the future. Now, what we've done here at ORCHA is we've reviewed thousands of products that against that criteria, and put that information into a global offering, which is covid19.orcha.co.uk, which is basically a digital health library. It allows you to search, and you can go here for free. This is our support, I suppose, for the crisis. We're not able to go into hospitals and put ventilators on people or provide PPE, but what we can do is provide a resource of high quality solutions that you can now go and find and download in a safe environment, because unfortunately only 15% of all digital health solutions meet the quality that you would expect. So you can go to this resource right now, and when you enter, you can see that there's a search bar. So all you need to do is just click into that keyword search and start typing in any words that you might be interested in. The areas that we've focused on for this digital health library are the areas that you can see on the screen. So this is about supporting specifically the vulnerable communities that are at home living with long-term conditions, who are worried about managing their health. And the idea here is that if we can support them to stay healthy and well, then they won't need to knock on healthcare providers' doors, which means more resource can be directed to COVID. As you can see, there's areas like diabetes, respiratory, which includes things like asthma and COPD. There's also areas of well-being, though, around diet and fitness. And there are other things such as COVID specific products. So we're seeing quite a lot of symptom trackers being launched, etc. So we're putting those products onto this app library. So you can search and find products that you might be interested in. Now, the apps that we've selected to go onto this environment, and by the way, when I say apps, I don't mean just apps on the App Store, I also mean digital health solutions, so web-based solutions, etc., has come from the already established 1,000 products that have already met a high level of assurity against standards. And we've chosen the products which have met the domain areas that I've just mentioned. Some of those products provide a replacement to normally receive face-to-face care, or that can support the general population to stay healthy and well, both physically and mentally. So if you want to go there, literally just go to the site, start typing in a keyword, and you can also use a filter system, which allows you to not only find the long list of, say, for example, the best anxiety apps, but also to filter according to your personal preferences and needs. And this is really important. So, for example, everybody in our house, I live with my 2 children and my husband, is probably feeling a little bit anxious at the moment because of the situation we're in. I think that's probably pretty normal. But if I'm trying to find a solution for my 6-year-old versus my 14-year-old versus me, what I'm probably going to find or need is something different. And so these filters allow you to filter according to personal preferences and needs, so that I can find the right anxiety product for me or my children. There are other filters on there around cost, country of origin, and the functions and features that the product has within it. Now, once you find the right product for yourself, you'll then want some more information. And what you'll see when you go onto this site is quite a lot of information about the review process and how it can support the COVID situation. So the product that you can see here is one for post-knee surgery and injury recovery. So this is for people who may have had surgery prior to COVID, but that are going through some rehabilitation. And what you'll see is this purple bar, which lists the benefits of this product during the COVID crisis, how to implement the product, any relevant case studies or links to clinical evidence, and any changes to pricing, because what we're seeing is a huge swell of people offering support during this crisis. And so a lot of products are currently offering discounts or free of charge opportunity. And then you simply hit download and it'll either take you to the relevant app store, or if you're on a laptop, a QR code that you can scan. Now, one of the things I just wanted to make a note of, just to really go into detail a little bit more about that example that I gave about me searching for an anxiety product for us in our family. There are obviously other mental health areas, and I know that Andy's mentioned there's going to be a pop-up specifically on this. It's just fortuitous that I've ended up with this slide for today. But I really just wanted to highlight that depending on the situation, the product will be different. And one of the key things that this app library is being used for is for healthcare professionals to be able to embed high quality solutions into clinical care and pathways. So, for example, the first product that you can see is for primary care to use for low level stress and anxiety for an adult. The second is across the IAPT pathway, or the mental health pathway, incorporating cognitive behavioural therapies, and so on and so forth. And you can see that each of those products are different depending on the requirement and the need. So it was just really to push a little bit further to say this isn't about pushing just one product out for the population. This is about helping your population to be able to find the right product for them. Now, one of the critical things that's really important for healthcare professionals who are using this system is how do you manage any future risks or governance. So my background is as an NHS clinician actually, and obviously if I'm going to recommend a solution to a patient, I need to make sure that it maintains its quality post that recommendation. And so what we've provided alongside this solution, or within the solution, is the ability for a healthcare professional to use it to not only download but also to recommend an app. As a professional, I get a code which I'll share with you in a second. Again, this is all free of charge, and a healthcare professional now gets the ability to hit a recommend the app button, and to not just recommend to one person, but can equally recommend to a range of people the same product. So if I'm a clinician working with a group of patients who I know are experiencing anxiety and depression, and I want to recommend everybody this product, then I can put their details into the system and hit recommend. The patient then receives a text message or an email, depending as to whether you've sent it via mobile phone or across email, to say that you've had a recommendation. And to be able to get your Pro account, it's very easy. You literally just go to the site, hit sign up, and then use Beat COVID-19, and you'll be able to generate your Pro account. Now, one of the things I just wanted to share with you is that this solution has been launched about 3 weeks now, so just coming up to 3 weeks. And what we've seen is a huge growth in the number of people coming to this library to search for and find digital health solutions. So we've probably seen a 50% increase in numbers of people coming to an app library to search for and find trusted solutions. Just to give you a bit of an insight into some of the highest search terms, the highest search term is anxiety, followed quickly by asthma, and then diabetes, which is basically telling us that our vulnerable communities are actively searching for these solutions. I'm hoping that Andy can circulate these slides, because what I've done is I've also put in here a couple of useful resources around blogs, and thank you for listening. Please do join us.
Thank you for that, Liz. And yes, of course, we'll share your slides. Thanks for that really informative look through what is, I think, is a fantastic resource for individuals as well as health professionals. And thanks for sharing that with us. We'll be sharing these slides afterwards, and we also will be featuring more of ORCHA's content as well through our member-to-member emails that we're producing.